Good afternoon, Meridian, and welcome to our final ribbon cutting event of the year. We're so happy that we're able to bring these events to you still while we're all trying to keep Meridian healthy and our friends and neighbors safe. So this event today is our final ribbon cutting of the year, and I'm very happy that we're going to be featuring a member that's been with us for a couple years. Actually, they're close to celebrating their 2-year anniversary as a member of the Meridian Chamber of Commerce, but they have an important new program that they want to share with us. And the ribbon cutting is for their new program. With that, I'd like to start it off with a little bit of a commercial for their new program. Thank you. Joining me today is the CEO of Northpoint Recovery, Mr. John Flanagan. John, welcome.
Thank you. Appreciate that. I appreciate everyone joining us for our virtual open house here on Facebook Live. And thank you to the Meridian Chamber of Commerce for sponsoring the event today. My name is John Flanagan. I'm the CEO of Northpoint. When I started at Northpoint back in March of 2019, I met a group of caring, compassionate, passionate professionals treating our adult patients. At that time, we only had adult services for patients struggling with addiction and mental health issues. As I started to look at the needs in the community, I had a concept of the Imagine programs. And as I got out there and met the professionals in the community, almost to a person, people ask me, when are you going to do something for adolescents? I think the area in Boise and the surrounding community really got used to Northpoint offering best-in-class care. And so they really wanted to see us do something with adolescent services. So back in February of this year, we opened our first Imagine program in Nampa. Very successfully opened. We got full with a waiting list. And then we had more need to be met in Boise. So we opened this program up this week on December 28th. So we're just excited to be offering this service to the community. Some statistics I'd like to share with you, and keep in mind, these are pre-pandemic statistics. Suicide is the second leading cause of death amongst adolescents aged 10 to 14. 62% of youth with mental health issues do not receive treatment. 8.6% of youth grades 9 to 12 reported suicide attempts in the past 12 months. And we know with the pandemic that these issues have increased, not decreased. And we also know that the silent epidemic that our young people face is suicide. And it's not talked about a lot. People don't want to talk about that. Parents sometimes don't want to admit that their children have issues. We want to break down that stigma. That's why we created the Imagine programs. I'm going to introduce in a moment Daniel Griffin, who's our program director, and he's just done a great job, and we're excited that he's joined us to lead these efforts both here and in Nampa. So with that, I'll introduce Daniel Griffin. Thank you.
Good afternoon. As John said, my name is Dan Griffin. I am the program director for both our Nampa and Boise facilities. And so I'd like to take some time today to discuss what we do specifically in both of our facilities, both here and in Nampa. So we are designed to help young people ages 12 to 17 who are coming out of inpatient care for an assortment of mental health struggles that usually result in suicidal ideation, suicidal behavior, self-harming behavior, and an assortment of other behavioral concerns. So we're designed to catch people coming out of inpatient, and we're also designed to prevent young people from going into inpatient care as well. So what we offer is what's called partial hospitalization programming. That's essentially a full week, day-long programming that's 30 hours a week of group structure. We have psychiatric providers that help with med management. We have individual counselors that help with individual psychotherapy. We have counselors who also perform family therapy. And we also have a medication provider. Something we really believe in as a company, and especially here at the Imagine program, is that it's not just one thing we're looking at to treat. We try to take everybody that comes into our facility and look at from a full spectrum of care. So we have medication professionals, just like physical medicine, psychiatric medicine, and social supports, parental coaching, you know what I mean? And so that's a lot of stuff that we do. We really try to look at every aspect of the clients we have in our care to ensure that they stabilize. And so they come with us for 30 hours a week. Our programming lasts for about 4 to 5 weeks, and at which time they drop down to what's called intensive outpatient. That's a couple nights a week to ensure stability in the home, ensure stability back at school, back at work for some of our clients who are employed outside of our walls. And we do a lot to ensure that people really start to look at themselves and understand why they've done the things they've done, to heal from trauma in the past, to find coping skills for their anxiety and their depression. And we really just look at it from a full spectrum picture of how we can help these people and their families. So some of the interventions we use are what's kind of the gold standard around in a lot of different facilities. We go a lot from a cognitive behavioral therapy standpoint. We come a lot from a dialectical behavioral therapy standpoint. And we also use EMDR in both of our facilities. And so that's something that we provide in terms of helping people heal from trauma and some difficult experiences they've had in their past. The staff here and in Nampa feel it's a blessing to really work in these programs. We really look at the individual and focus on their needs first. And we couldn't be more excited to be doing what we're doing. So all in all, we're excited to be here, and we look forward to growing this program and providing the best care possible.
Daniel, thank you so much. We really do appreciate all that you do at Northpoint and serving all of Treasure Valley with your services. So thank you very much. The Meridian Chamber of Commerce has a great working relationship with the City of Meridian. And at our ribbon cuttings, we like to welcome in someone from the city to share a little bit. So with that, I'd like to bring in with the City of Meridian, Jody St. Martin. Jody, how are you today?
I'm great. Thank you so much, Sean. Welcome. I'm glad to be here to celebrate with Northpoint Recovery. We know that without the valuable resources for mental health, drug addiction, we lose more people to suicide. And so on behalf of the City of Meridian and Mayor Simison, I want to thank you for bringing these resources to our community. Meridian is, and our desire is to always be a premier place to work, live, and raise a family. And with resources like this that create such valuable adds to our city, our community, we thank you, Northpoint Recovery, for being here and being available.
Thank you, Jody. Now we have Danielle Finopoulos, the Outreach Manager at Northpoint Recovery. Thank you.
Hello, everyone. Thank you for coming. So as John mentioned before, we did do a community assessment to see what the needs were out in our community. And, providers and therapists and school counseling and parents all wanted more adolescent program. And so I think that's really important that we were able to see that in our community and really make some action towards that. However, what I've noticed is the increase with the teens and their positivity. So at first, some of them come in dragging their feet, not really wanting to come here. But within a day or two with Daniel and his staff, you start seeing these adolescents who don't want to leave us. So it's a really neat change to see with these adolescents. They get to be themselves. They get to have this free space where they can express themselves and talk about their feelings and what's going on. And they know that they're supported. And they just do a really amazing job here. If you want to find out more about our program, you can go to boiseimagine.com. We have a lot of great information on our website. And then I also would like to introduce Erica Lopez, our VP of Idaho. Come on up.
Thanks. Oh, I'll take this off quickly. I get to do the fun part, so thank you for attending our virtual ribbon cutting today. I will invite my colleagues back up so we can do this awesome ribbon cutting and celebrate with you. Again, thank you for attending and hearing out what we have to say.
Well, thank you, Danielle, and Erica.
All
Let's go ahead and
right.
get your crew up there to do the ribbon cutting.
Okay. Should we do a
Whenever you're
count-off, I
ready.
suppose? Yeah. Okay. 3, 2, 1. All right. Yay! Thank you. Yes, thank you.
Thank you.
Thank you.